Hello everyone. Hope all of you are fine and doing well in your school or in your preparation for your exams. And first of all, I really want to say thank you to all our subscribers. We've crossed 100 subscribers. Yay! And I'm really hoping that you continue to like our new videos and gain the most from them. Okay. So this video I've named it as ACT, and from the heading, you must have understood it's about musculoskeletal injuries and the wrist pains, inflammations that we dentists have to deal with, back pain, the wrist pain, hands, oh my God, whatnot. We've all heard about these things, right? In our first year or from other dentists or anyone, any dentist you meet, someone has some issue in a hand, right? But still, does it really help that we are aware of something, but we do nothing? I mean, uh, by nothing, I mean, seriously, do we actually take care when we're working on a patient? When a patient is in the dental chair and you are so focused on your work that you actually don't pay attention to yourself. You never think, oh, is my hand in the right position? Or did I take a break in between just to stretch myself? No, you're not even thinking of that. And that's the reason I've named this video for ACT. A would be standing for awareness, C is being careful, and T stands for treat. So aware, be careful, and treat yourself. So just to give you a background why I decided to make this video, although I've been meaning to make more educational videos, this one video is very personal because recently I had tendonitis. Yes, I had wrist tendonitis. And how it all started was I've been in dentistry for quite a long time. I've been doing perio, I've been doing surgeries, and I never had an issue with my hands as such. Yes, because of my, injury, falls in the past. I've had, ligament tears in my wrist, but it's nothing that has become so bad for me to take rest. But this time it did. So what exactly happened is that I started having a little bit of pain while working, and like most of us do. Oh, it's just a sprain, it's nothing, just take a painkiller and you should be fine, just keep continuing working. And gradually it becomes a little bit more, no, work is still important, no, 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 you continue working. And one day it becomes really bad, right? And that happened to me. In my case, it became really bad. I could not even hold anything. It was hurting, it was shooting pain, and it was happening in this region. This is the tendon, the wrist tendon that mostly gets involved. And I wasn't aware of tendonitis. And you tell your friends or you tell someone you're close to, and I don't know about other people, I cannot really say, but the friends or the colleagues I was mentioning this to, they mostly were like focusing just on the fact that maybe I'm overthinking too much. No, you have to work, or it's just a bone pain. Oh, you have weak bones. Do some stretching, it should get better. Don't pay much attention. Not to like really, put a negative light on people around, but just to mention that this is common. This is very common when you have some issue, you probably talk to someone, and it might happen that certain people would not really understand. Maybe they've never been through that situation. So mostly will ask you to just shun, this situation, or not even think about it much. And you would do the same, right? Because you have people around you who are doing just fine, and you do not want to be the one odd person who's not doing or having some issues, right? This is very common. um, and I kind of like ignored my pain for quite a long time. uh, but yes, the tendonitis pain doesn't really get better if you don't give it rest. It just becomes bad and bad, and mine became bad to the extent when I had to literally give it a rest. I could not do anything. My daily tasks were becoming difficult to be performed. Even in and schoolwork, yes, it's a big stress. I don't know how many of you've read my articles, but I've been publishing a lot of articles on mental health in American Student Dental Association magazine, and different blogs. But mental health and physical health are very, very important. If you're not mentally well, you're not physically well. If you're not physically well, you're not mentally well. And you do not really realize these when, I hope you do not have to, but I think this is something you should be aware of, that you know you have to take care of them. You just cannot be so engrossed in your work and just looking at the goal that you miss the whole journey. Anything that happens on the journey that might impact finally when you reach your goal, and health is one of those things. And for us dentists, it's our hands that are really important, our back, that's really important. We have to, this upper part, that's mostly involved with the kind of things we do. It really takes a toll on your physical health. And you have to make sure that you take care of them in the best possible way. So, this video is to make you aware, okay? My therapy. First thing, aware. Be aware of things that can happen to you. When you are enrolled in a dental school, the first few classes are about ergonomics, about making you aware about musculoskeletal injuries that you can have. Then that would include tendonitis, that can include synovitis, that can include carpel tunnel syndrome. Oh, lots are there. You can actually Google. I'll add a list of few of the sites you can go to for health awareness, and you should be aware of these issues. The purpose of getting aware is not to be like psychologically inclined only about thinking, oh, this can happen, but it's not a bad idea to be aware, to be cautious. You have to be cautious that this can happen to me. It doesn't really matter what is your age, you know um, it is again a very common myth that these things only happen to old people. No, it can happen to anyone. These issues are arising because of overuse. You can be a young person in your 30s, or and working like anything, not giving a rest to your arms, not giving a rest to your body, and you can have these issues. So that's one myth that has to be dismantled, that there is nothing with these issues that is only age related. And please do not believe anyone who tells you the same. It should not happen to a young person, it only happens to old person. No, it can happen to anyone, so anyone has to take care of it, right? So that is all about awareness. C is careful. And by careful I mean is, you have to be, along with your awareness comes how you can be careful. If you are aware that I can get tendonitis, I can get carpal tunnel, I can get any kind of musculoskeletal injury in my joints, you will be careful. And for being careful, you should have the resources on how to minimize that problem, right? And how to prevent that problem from happening. Now again, like I said, I will be putting some links. So you can go through those links, or you can do your own homework, go to different sites and just, be read about it. What kind of movements usually tend to cause these issues, or what are the ways, like stretching exercises. Usually doctors will tell you that in between every task you're doing, give yourself a 10 minutes break. Just stretch your shoulders, your neck a bit, your hands, these tiny hands you never pay attention to. Yeah, the tiny fingers. Yes, you need to stretch them, you need to give them a break. And you will actually realize that how much you've been overusing them once you start stretching. Because when you start stretching, you realize, oh my god, they got so stiff. I was just stuck in one situation doing making this cavity in operative dentistry, and I never paid attention that my hand was stuck in this position for 1 hour. And when you actually try to stretch it, and then you'll realize, oh my god, it just hurts here. Yeah, because you made it so rigid, you made it stiff. And it has nothing to do with weakness. That is another thing I want all of you to know. If someone tells you, oh, you're hurting because you're weak, please don't listen to them. Okay? It has nothing to do with weakness. Yes, there are certain people who will not have such issues. But if you are having that issue, doesn't mean you're weak. Everyone has a different kind of body. So maybe your pain threshold is not that great. And that doesn't make you a bad doctor either. I've heard all of these things in the past few days a lot actually. Pain threshold is not good, or people will bring their pain experiences and tell you, oh, how I was bearing with it, I was doing everything, oh my god, lots of things. Another thing, please don't listen to people when it comes to your body. Your body is your body, you have to take care of it. You know what's happening with you. You are aware, I do not have the strength, I can make it better. So being careful comes the whole concept of minimizing and your pain or your problems, and that means yes, start exercising. Start looking at different, maybe going to the gym. Start strengthening your muscles, your tendons. The stronger they are, the lesser you will have any issues with them. The more ability they will have to do any activity. So yes, you have to just look at that thing stepwise. But regardless of that, it can happen to anyone at any point, and it has nothing to do being with weak. So don't listen to that word. Okay. And the last thing is treat. I hope if you are following awareness and C principle, you do not have to go to treat. But if at all you experience any kind of difficulty, okay, you experience, oh, there is a stabbing pain in my wrist joint, or there is a gnawing pain in my arm or my forearm, or in my back, I'm feeling stiffness, you know, take a step back. Take a step back and just pause there. Give your muscles, give your body a rest there. And if it is something that is not going away with the rest or with your anti-inflammatories or over the counter medications, which should not be taken just like very casually, but maybe over a week just to see if it's working, then go to a doctor. Get it treated. The earlier you get it treated, the faster it heals and lesser time it takes to, for you to recover from it. And the situation does not go to a stage of chronicity. You do not have to get caught in a rut, that kind of a cycle where you did not take a break, you just take some anti-inflammatory, it gets fine, and you go back to work, it comes back again because it never got the rest. Rest is something we all take granted for. um, you know, uh, Sometimes people tell you you should not take enough rest. Rest is, you do not need at this age because everything is somehow related to age. You're young, you do not need rest much. You're young, it should not happen to you. Um, I really like, that one reason of making videos is just to create awareness that things are not always age related or age associated. Bodies are, you have your own body, you have your own mechanism, and anything can happen to anyone. Okay. So just please pay attention to yourself. Don't really look at anything else. So I hope with this video I have managed to create some awareness and help you guys understanding if you are going through a pain like this in your hands, in your wrist, or in your back, or preventing any such a situation. So please go through the links. Please be aware, act, be careful, and treat yourself. Good luck.